it's not a review of all recent research of PRRS, of course. I would never be able to do that. We're going to specifically talk about a couple field studies exactly on time to PRRS, time to stability for PRRS and time to baseline production for PRRS. Two studies, one with 61 farms, a cohort of 2009 to 2013, with 61 sow farms, and a more recent cohort of farms that broke with PRRS between 2014 and 2016. We're talking about 107 herds in the second cohort, and we are going to summarize those findings, compile the data, and try to understand factors associated on how to decrease that time to stability and time to baseline production. The big take home is that we believe that we are doing a good job as an industry collaboratively in regards to time to negative pig or time to stability, but we're not doing great. There is still lots of opportunities to not only decrease that medium or expected time to stability, but also to increase the success rate of actually reaching stable. As we will see, there are not all herds that start the program to reach stability, they get there. And so let's look at the findings here. I will start with the summary of what we saw, combining the results from those two cohorts, 61 plus 107. We're talking about results from 168 breeding herds. I should have said that the lead author, the lead investigators for that second cohort were Carl Betlek and Dr. Bob Morrison. So what we saw in those, overall in those studies was a success rate of 60 to 80% of success of reaching stability. 80% of herds in that first cohort of 61 herds, they reached stable, and only 60% of the second cohort of herds, the 107 herds, reached stability. We're going to discuss a little bit on things that we think are associated with that difference. We also saw a big variation of time to stability, 24 to 60 weeks to reach the fourth negative test. Just reminding that when we talk about stability, we're talking about diagnostics, we're talking about getting 4 consecutive negative results of PCR, of pig blood, at least 30 samples of pig sera, and testing over time. So when you reach 4 consecutive negative tests, herd is called stable. There are 2 ways to do that. At that first study, we defined stability as the very first test, followed by 3 negative tests we called stable. In the second study, the authors prefer to call the 4th negative test. So just to summarize, 24 weeks to 60 weeks was the time to reach the 4th negative test. Or if you want to consider the first negative test, just go back 12 weeks. So we're talking about some 12 weeks to about a year in the range of stability. So the TTS, the time to stability, and the probability to reach stable, they were better in the 2009 to 2013 cohort, as we said, compared to the more recent cohort. And the main differences, as we're going to talk about more in detail during the presentation, between those two cohorts was that the first cohort, with 61 herds, all of them did herd closure. They did whole herd exposure with either with a live virus, either serum inoculation or use of vaccine. And of course, the PRRS viruses were different between those two cohorts. So herd closure, whole herd exposure, and PRRS itself was those factors, as we're going to talk more about the presentation, were the differences between the cohorts. Another study that we're going to show a slide here about is TTS at farrowing, more specifically time to test negative at the farrowing, the first 24 hours, testing pigs within 24 hours of birth. And the best results were at 8 weeks after PRRS detection, and the median time there was about 20 weeks. So what that tells us is that pigs, they reach stability at birth first, and then, of course, there is some PRRS transmission going on in the farrowing house, and it takes more time to reach stability when you test pigs at weaning. So we understand that there is a lot of opportunity to decrease the overall time to stability at weaning by influencing that circulation of PRRS virus during the farrowing phase, at the farrowing room. And then we're going to talk about the wind down project, which we understand when we believe we're very optimistic that can help decreasing that pressure of infection. We're going to talk more about that. So here another slide with the variation, with the distribution of the time to stability with those two studies combined. As we said before, it went to a minimum of 24 weeks, and it went up to 60 weeks to test, to reach the fourth consecutive negative test. Big variation. And good news here is that early TTS is possible. We had at least some 10 herds that had started testing negative as soon as 12 weeks after PRRS detection and intervention, and were obtained the fourth negative test by 24 to 30 weeks after detection. So what we are going to discuss here about in the rest of the presentation is those factors that we believe that are associated with those early TTS herds. So it's a big, the next topics here going forward, we're going to quickly review the 2013 study, then talk about the more recent one, compare those studies, talk about the TTS at farrowing, talk a little bit about the wind down project, and go back to the summary slides. So the first study with 61 farms, what was that about? Just reminding here that those herds, what they had in common was that they were acutely infected breeding herds with PRRS virus that used herd closure associated with whole herd exposure, or also called load close expose method, with either a resident virus, also called serum inoculation or live virus inoculation, or with MLV vaccine. So herds broke with PRRS virus, did a herd closure using resident virus or MLV vaccine. And all those herds had the intention to start producing negative pigs at weaning. In other words, intention to achieve stability. Some herds were infected with 144 kind of virus, some with other kinds of virus. There was also a variation in the prior history of PRRS detection, and we were talking about 61 farms belonging to 16 different production systems or vet clinics. And what we saw that for MLV herds, the herds that did herd closure and used vaccine as part of the exposure program, they reached baseline production defined as number of weeks that it took to produce the volume of weaned pigs at weaning that the herd had prior to the break. So they reached they recovered productivity levels significantly before they started producing negative pigs at weaning. We had that big window of what we like to call the silent PRRS period, when you had no clinical evidence that virus was there in the farm, but yet you did have some virus shedding going on. What makes us hypothesize or come with this idea that what if we had better influenced internal circulation of the virus in this phase right here? Would that have reduced the time to stability at weaning? In other words, implementing McRebel-like practices, strictly not cross-fostering, all that kind of stuff, all those management practices to reduce likelihood of virus transmission in the herd. could that have would that have reduced the time to stability? That's something that we're going to talk about later on in the presentation. But a big take home here so far is that there is this significant amount of number of weeks where you walk in the farrowing house, you don't see any kind of signs of PRRS, volume of productivity is already recovered from the compared to the baseline, and yet you have a lot of virus circulating for a significant amount of weeks. So don't take home that we discussed with the participating producers and vets was do not trust your eyes, trust diagnostics, and keep biosecurity practices strict until you have diagnostic evidence that virus is not there. For herds that use a herd closure associated with live virus inoculation, time to stability was sooner than that of herds that use MLV. But on the other hand, baseline production came after the MLV herds, and that window of the silent PRRS phase was shorter. So take homes here, herds that use MLV, they reached productivity levels before, so the production impact in those herds that use MLV was less compared to the LVI group, but the herds with MLV, it took longer for them to reach stability. So major findings, as we just said, for that study, shorter time to stability was associated with the herds using live virus inoculation as part of a herd closure program. There was a particular vet clinic that had a better TTS compared to others, and prior infection history was also protective in that cohort. For production impact-wise, the TBP, it was better in the MLV herds, and also in a particular vet clinic, the same clinic that had a better TTS, and also prior history of PRRS detection was also significant. Other important findings that is related to what we are discussing today was that the intermittent pattern of PCR of PRRS RNA detection by PCR using 30 pigs at least, there was some 40% of herds that had at least one negative test followed by a positive one, just showing the importance of monitoring over time as opposed to just one point in time. If you really want to go after time to stability, it's important to test over time and have confidence that virus is not only at a very low prevalence, near zero, but it's not, you have at least more confidence that it's not there. And talking about success rates, some 80% of farms that adopted load, close, expose, they reached TTS, and 72% of those herds that adopted load, close, expose, they reached the provisional negative status, that is, kept testing PRRS negative after guilt introduction into the herd. So let's talk about Carl's study here, the 2014-2016 cohort with 107 farms, 5 systems. Those were swine health monitoring project breeding herds that were infected with virus belonging to the RFLP pattern of 174. Understand that they were not talking about exactly the same virus there. There is probably some important variation there. But one thing is that I would say that the genetic variation of virus from this cohort was less than the previous study that we discussed. There was an agreement to test for TTS using the same testing protocol that we used in the previous study, 30 liters, pooling by 5, so 6 PCRs of 1 to 5 pools of at least 4 consecutive times to achieve stability. And one very important difference here, other than the viruses, was that there was no requirement to implement herd closure or whole herd exposure. In fact, most herds of this study, they did not close their herds. And a good chunk of herds, they did not use any kind of exposure. They just relied on natural transmission of the virus and natural immunity going on. So a big difference here was that most herds did not use herd closure. The previous study, all herds used herd closure, and a lot of herds here did not. Whole herd exposed themselves with vaccine, while others did use vaccine. Okay, what did we see? For the 2016 study, the median TTS compared using here the time to reach the fourth negative test. You see here a Kaplan-Meier plot, just reminding here what we're talking about. It's we see here that the probability of reaching TTS over time, okay? And so as we started testing the gilts, the herds, at about 12 weeks after PRRS detection, and as time went by, as you see lines going up, that means that they were reaching stability. So what we see here, what the plot shows us, is that you had different patterns, each line here, each color is a system, and you saw some systems that consistently reached stability sooner than other systems. And so, I'm not talking about all giving numbers here for all the 5 systems. Let's focus here on what's interesting. What's interesting, what I want to show is that there was a particular system with a median time of 37 weeks, while the other system that took longer to achieve stability, it took some 44 weeks, and that was different statistically. So different system effect. And so that's an important point to discuss and better understand what are they doing and how to replicate that. We're going to talk about that later. Another finding, now comparing, we merged the data sets, the databases for the 2 studies, and you see here the same plot, but now each line is a cohort of herds. The blue line is the cohort of the 2013 herds, and the red line is the 2016 study. And what you see here is that the herds that achieved from the first study, they reached stability significantly sooner than the more recent herds. And not only that, but as you can see up here, in the upper right corner, was that more herds achieved stability in the 2013 study. So the probability of actually reaching stability was much higher, as we're going to discuss in a little bit. So we said that in this recent study that there were some herds that did nothing in terms of exposure, herds that used vaccine, and we had just a handful, or not significant amount of herds that used live virus inoculation in their herds. As we saw before, it's very maybe they didn't use, because today we know that using live virus inoculation, there are some negative, very significant impact in production. So in this more recent cohort, people did not use that. And so what if we compare only the herds that did MLV? What we see, what do we see? We see similar lines here, consistent lines, but the herds that of that previous study, just like in the other general, in the combined data set, they reached, the probability of reaching stability was higher, and they did better. So this difference was not statistically different, but as you can see, there's an important trend that can't be ignored. So there is a numerical or a difference or an important trend, maybe associated with herd closure. So and what else? Talking about TTBP, so similar situation here. We are seeing 2 lines. Each line is a cohort. The blue line, the 2013 herds, and the red line, the 2016 herds. And what you see here is that these herds, these more recent herds, they achieved a stability, they achieved baseline production sooner, which is expected. Again, they did not, it was not frequent the use of live virus inoculation. It was frequent doing either nothing or using vaccine to reach stability. So it makes sense that baseline production came sooner than before. And I believe that's the last Kaplan-Meier plot here, comparing closure, yes or no, for herds that did closure until time of gilt introduction. And as we described, as we said, herds that did close their herds, they achieved stability sooner than those that didn't. So summarizing all those Kaplan-Meier plots in a more kind of in a different way here, this table. The first line here is the median time to achieve stability, or the TTS 50. The early ones were around 24, 28 weeks to achieve that fourth negative test, and the median time was 38 weeks versus 44 weeks, comparing the 2013 versus the 16 study. The baseline production was the other way around. As expected, the more recent herds recovered production sooner than the 2013 herds. And talking about success rate to reach stable, the more recent herds, 62% of those reached stability, 40% never reached, and 80% of herds from the first study reached stability. So important difference here in the probability or the success rate to achieve stability. Now we are saying that we saw that plot showing that stability, there is a big variation of time to stability, and we did see some good proof of concept herds that had some early, relatively early TTS. And how do we replicate that? How do we get TTS shorter? As we said, as I said in the beginning, we're doing a good job, we're getting there, but we believe we can do better than that. We have to increase that success rate. We cannot live with 60% or even 80%. We gotta be able to find a system that consistently gives a sooner, a quicker time to stability. So, Carl and Bob did this study. It's still preliminary here. We don't have all results yet. We're still waiting for the results at weaning. But what was done was the time to stability at farrowing. So again, what does that mean? How long did it take to start consistently producing negative pigs within 24 hours of birth? And so how did they do that? Enrolled some herds and tested PRRS RNA by RT-PCR from those piglets, and tested them within 24 hours, and herds were asked not to cross-foster, and the median time was about 21 weeks, and the range was something between 8 and 32 weeks, as you can see in this plot. So again, as early as 8 weeks after PRRS detection, there was already a number of herds producing between 8 and 10, and here 12. You see a lot of dots here at 0%, showing that there was a lot of herds that were already producing PRRS negative pigs at farrowing. The hypothesis here, if time to stability is so variable, in that we just saw that the stability at farrowing or within 24 hours is happening much sooner. In some situations, 12 weeks to 16 weeks sooner. That's a lot of time. Why don't we go to the farrowing house? Is the answer there? Would decrease the virus circulation? So again, the hypothesis is that what if we influence that PRRS transmission in the farrowing house and reduce the chance of virus to circulate and to replicate and to be transmitted in the farrowing house? Can we decrease the time to stability at weaning? That's the ultimate measure anyways. It's at weaning that we have to look at. So that's exactly what Dr. Carles Villalta and Dr. Bob Morrison did with a model. They modeled the transmission of PRRS and predicted with a modeling approach, mathematical approach, that the wind down approach would significantly reduce time to stability. And what's the wind down? That's a very similar approach to what we are already doing with to eliminate PED in a lot of herds. That means weaning piglets from 7 days old to up to 21 or 24 or whatever age the herd, whatever it's the regular weaning age for the herd. So weaning down or weaning pigs at 7 days of age and older, and do that for a week, for 10 days, that would significantly decrease the probability of virus circulation and transmission in the herd, and with that would significantly reduce time to stability at weaning. And for that study, and would like to invite you all, if you have breeding herds, to enroll. There is a BI grant to help subsidize diagnostic test costs, and the goal would be to enroll 30 wind down herds compare their time to stability with matched herds with a non-wind down. So if you're interested, go ahead and contact us, contact Bob, and let's discuss that. So going back to the summary, what we have discussed, data from 168 breeding herds, we saw that there's a big variation of TTS. We already knew that. I would like to highlight here that early TTS was possible, multiple herds, not only one, so proof of concept is there. We should not be happy what we're doing today. We have to look at ways to reduce not only the TTS, time to stability, but also increase that success rate. Is the answer in the winning down? We don't know. There is only one way to find out, but we are very optimistic on that and wanted to test that. So early TTS is possible. Let's keep exploring that. And TTS and probability to reach stability were better in that first cohort compared to the more recent one. And what was the main differences between those cohorts was that, again, that first set of herds did implement herd closure associated with whole herd exposure, and of course virus was different, right? There was a difference in the virus. Which of those three were responsible for most of those 40% failure? We don't know. Maybe all of those combined. So it's a study looking at those together. All together would say that doing herd closure and whole herd exposure, it was at least not a bad idea. Those herds did a better job. So further studies are needed with current practices today, with the virus that we are circulating today, and replicate that study of herd closure, maybe comparing herd closure with no herd closure. And so, and the final line here is the wind down. Is that the answer? The wind down and / internal biosecurity practices to decrease TTS? We do believe that there's a lot of answers in the biomanagement or the internal biosecurity or practices at the farrowing house that might be, we still need to explore that and associate that with our outcomes, including not only TTS but the TBP. But to keep it simple, wanted to focus this talk on TTS. They kind of go together.